It seems there's a mental health crisis gripping the workplace. I found this interesting article from Business Insider that talks about mental health and the workplace, and I thought it would be interesting to see what experts have to say about this. So let's dive in. The title of this article is Your Manager is Not Your Therapist. Interesting. One of the things the article goes on to say is one of the worst things your company can do for your mental health is talk about it too much. So let's take a look at what the experts have to say about this. It says Gen Z wants to talk about mental health, and I think that's true. In a 2023 survey of 3,000 people, Gen Z was twice as likely as other generations to say they struggled with their mental health. I think with Gen Z having grown up with new technology and more social media, they're more open to discussing things like mental health. And it goes on to say, anecdotally, managers have said their youngest employees confront anxiety and have no qualms about openly discussing it. Now, I think this is probably true. I will say that in my personal experience, I haven't noticed a big difference in younger employees versus older employees discussing mental health. In fact, most of the time in my experience, people just don't discuss it at all. I can infer sometimes in discussions with people that they may be a bit concerned about either their mental health or the mental health of other people, but it doesn't really come up in an explicit way. I'll talk a little bit about my own experiences later in this video as well. And here it says that Gen Zers grew up with a movement to destigmatize mental illness. And I think this is a good thing because in the past, it's true, mental illness was stigmatized and it wasn't treated quite the same way as if you had some other kind of health issue, such as like a physical issue. It says they've watched celebrities like Selena Gomez, Simone Biles, and Demi Lovato speak out. And I think with some of these celebrities speaking out, it's sort of imprinted in the culture that it's more okay to do so. Over the years, they say that depression and anxiety has climbed through the roof. Now, I have my own theories about this, and there's a lot of research done on this as well. I think there's a number of contributing factors to this. People do say that the rise of social media can contribute to anxiety and depression. I won't go too much into details, but there's issues about blue light at night. So if you're using your devices late into night, it can actually disrupt your sleep patterns, and sleep is very important for mental health. I think, secondly, there's evidence to suggest our brains are not constantly wired to be on all the time and to be super reactive at every instant. And that keeps our fight or flight response on and high alert at all times. Because in today's world, it can be hard to have real downtime for rest and relaxation. We're constantly on, we have our phones, we have our chats. Many people are working jobs across many time zones. And so they pretty much have to be on much longer than a 9 to 5 job historically would have them be on alert. They're expected to answer emails in the evenings, texts in the mornings. There can be meetings at all odd hours. So while technology has made us much more productive, I think it's come at a price. And the price is mental health if you're not careful about putting boundaries on how you use the technology. Okay, the article goes on to say there's been an overwhelming increase in demand for mental health care over the past few years. 94% of companies employing more than 500 people have added mental health benefits. So this is good. Employers have noticed the need for mental health support and they've added those benefits as programs for their employees. Now, the article goes on to say, hey, there's just one problem. While destigmatizing mental health is important, a workplace overly focused on mental health isn't always a recipe for better mental health outcomes. Interesting. Basically, what they're saying is that if you talk about it too much, it can make the problems worse. Now, my observation, having worked for a couple of decades plus, is that generally these things do happen. I'm not a mental health expert, but as a generality, what I've seen is the pendulum kind of swings back and forth. So it's possible, I'd say, that in fact, talking about this too much can actually be problematic with people maybe self diagnosing themselves or overanalyzing the situation. In a nutshell, though, I think it's good that employers provide these programs for their employees. The article goes on to say that Americans are overwhelmingly worried about a mental health crisis. In fact, in a poll by the American Psychiatric Association, 79% they viewed mental health as a public health emergency in the US. Wow, that's a very high number. And then another poll, when asked about crucial issues for the 2024 presidential candidates, they said that mental health care was more important compared to immigration, gun violence, abortion, or even the climate crisis. Wow. So, what these polls suggest is that mental health is a huge issue for a lot of folks. In fact, the polls are suggesting it's a crisis that needs to be addressed. According to another poll, the share of Americans that have been diagnosed with depression increased from 20 to almost 30% between 2015 and 2023. In 2 decades, Americans who received mental health treatment shot up from 27 million to 56 million in 2022. And physicians are basically reporting that their patients' mental health was declining. And then the article goes on to say that among young people, the problem is even worse. If you're under 30, you're far more likely than those in the older groups to report that you're depressed or anxious. And then another survey found that only 64% of Americans between the ages of 18 and 29 said their mental health was good. And that was less than any other age group, and a stark contrast from the roughly 90% of people over 45 who said the same. So I think there's good evidence that the younger generation, and Gen Z and so on, are especially feeling the effects of depression and anxiety. And so I'm not a mental health expert. And so I'm going by my own sort of observations here. Is I think part of the problem is that the younger generations face a unique set of challenges. I think social media is probably one part of that, in that it creates an always on culture. It probably disrupts sleep patterns. And then on top of that, you're constantly exposed to comparing yourself to other people on a scale that we just didn't have before. And then on top of that, if you are at a company with a very demanding work culture, for a long time now, in some areas, we've had this hustle culture where companies want you to do more with less. And having to be on for most of the 24 hours in a globally connected workforce where you can be pinged on your computer, on your phone, no matter where you are at any hour, is certainly taking its toll on a lot of people. It's leading to a lot of burnout. Now, I can speak for myself and say, in my case, I've certainly had some of these challenges in terms of being burnt out or close to getting burnt out. And I'll talk briefly about what I've found to be effective. So I think the first thing is to address sleep. It's easy to get into a situation when you're overworked to think, hey, I'm just going to cut out some sleep here and there. And slowly, instead of that being the exception, it becomes a rule. So I'd rate sleep as one of the most fundamental things you should do to address mental health issues. Secondly, what I'd suggest is getting some exercise, even if it's just light exercise. Make time for exercise, even if it's just a walk around the block, even if it's just doing your meetings or your one on ones. Take the time to get some movement, some body movement, because what I found is that it helps to de stress the body. And there are just some systems in the body that work well only if you move. Then after that, make sure you have downtime. You take time to connect with nature or with friends and family if you have it, because for many people, having those meaningful social connections goes a long way in preventing burnout and addressing mental health issues. And then on top of that, you can start to look into practices such as meditation, which I've personally found helpful. I know it can be challenging because the whole reason that people often don't do those things is because they're challenged to do them. They don't have time to do them. But that's when saying no and taking a critical look at your calendar and making time for the important things really, really counts. There's a saying I remember, And it goes something like this: if you don't make time for wellness, you'll be forced to make time for sickness. So if you're feeling close to burnout, if you're feeling that you may have some mental health issues to deal with, take some time to do a bit of an audit, see how you spend time, and see how you can devote some more time to self care. Okay, well, the article goes on to say that poor mental health reduces labor force participation, work engagement, job performance, and costing the economy 50 billion lost productivity a year. And companies, and a lot of companies, 77% of companies, according to this survey, reported an increase in mental health concerns among their employees. Wow. So the reason these companies are offering these mental health benefits is simply because they know it'll impact their bottom line if they don't. If they don't offer these things and there's evidence that a lot of employees have mental health issues, they're not dealing with it, it will impact productivity. Okay, so it says that to address the problem, HR has flooded the workplace with programs, everything from online resources and partnerships with wellness and therapy apps like Calm and BetterHelp, including seminars, meditation, yoga. Companies are also pushing for cultural change. According to another poll, three-quarters of workers polled said it was appropriate to discuss mental health at work, and even more said that supervisors and senior leadership were responsible for helping employees feel comfortable discussing their mental health. So, okay, so let's talk a little bit about the programs. If you think the programs in your company are helpful, please comment below. I have personally used some of these apps like Calm, and I think they can be helpful. Meditation, I think, can also be helpful. What I've observed and would suggest is that it's useful to use these programs and use the things like the apps, the seminars to get the information you need. And you can even use coaching, one on one coaching. Many companies actually offer that. So if you are in a situation where you feel you're burnt out, close to burnout, you have some mental health issues that you think need addressing, it's useful to first go through those sort of base level programs that they offer, and then see if your company's benefits include one-on-one coaching. The benefit of the external coach is that they are required often to keep it confidential. Make sure you check that and verify that before you engage in this. When the article says that it's appropriate to discuss mental health at work, I would caution this a little bit. I personally would not discuss any personal mental health issues at work of my own, but I'll caveat that with if I had a benefit the employer provided of one on one coaching and I knew that that was confidential, then I would look to take advantage of that. Why is that? Well, the reason for that is that I think if you talk about mental health issues at work, it could still be viewed as problematic in terms of your future performance. I think every situation is unique and different. So, unless you have very understanding management, you'd put yourself, unfortunately, in a difficult position because I think the majority of companies out there, when making considerations about things like who gets the important assignments or who gets the promotions, would basically look at what future contributions the person could make to the company. And so if they think your mental health issues could get in the way, they would probably think twice about that. Okay, so it goes on to say on TikTok, people are recording their on the job breakdowns. And this is much more common with Gen Zers. And they're swapping tips on avoiding toxic workplaces. And now there's even TV shows talking about it. So there's widespread agreement that companies need to do something. Okay, so the article goes on to say that breaking mental health stigma is important. We talked about that before. And it's a good thing when workplaces become supportive environments where colleagues and supervisors view mental health issues humanely. And I agree. It's better that companies now have at least some programs and systems in place to help employees who might be suffering from mental health issues. But then the article goes on to say there might be a limit. Too much mental health can actually be counterproductive. And it goes on to say that negative emotional experiences that were once considered a normal part of life have increasingly been viewed as signs of psychological disorders. Trauma, for example, once referred to the severe psychological stress that came from rare, life threatening experiences. Now it's used to describe less severe distress by a wider variety of adverse events, such as exposure to offensive speech or violent media. So basically, the article is saying that now we might be talking about these kind of issues a bit too much. What do you think? Do you think that's the case? Let me know in the comments below. And they're saying that this increase of public awareness may have actually made the problem worse because essentially people misinterpret normal levels of discomfort as abnormal. Well intentioned efforts to get people to think and talk more about mental health may inadvertently promote excessive dwelling on negative emotions and personal insecurities, known in psychology as rumination. And basically basically it increases psychological distress, which essentially makes depression and anxiety worse. Now, I can't say I've personally seen this in the workplace. I definitely have seen a big increase in the number of programs that are offered, things like classes, even things like coaching, external coaching. But I have not seen cases where individuals speak about their personal issues as much. In fact, I'll give you one example, an anecdote. When I was working at a company and we went through a reorganization in which we had to combine departments, and a lot of people from one department got merged into an area that I was looking after. And unfortunately, as part of that restructuring, there were layoffs. Now, one of the people that was slated for a layoff wasn't performing very well. And I actually went to HR because I thought that the person may have been suffering from depression. So I wanted to see if there was some way we could figure out if that was the case, if there was anything we could do. But the message I got back from HR was basically don't talk about this again. And I think the takeaway here is that yes, companies do want to offer these programs to help employees generally speaking, but there's a limit to what the company will do. And I think it essentially comes down to the bottom line. So if you're outside that band where the company thinks the general programs can help, you essentially become a kind of liability to the company. The company thinks that you might have mental health issues that are essentially too much and that can impact your work. At the end of the day, the company is there to generate profits and maximize shareholder value, and they're not really there to treat you as your friends and family might treat you. So it's important to remember that there are limits to what a company is willing to do. And that's why for me, I would be very cautious about talking to people at work about my own personal mental health issues. I'm not saying this is true for everyone. Everybody's situation is different. And if you have a very supportive management team, it might be different for you, but be very cautious. Now, the article goes on to make a very important point. It says that the more people view their lives and work as meaningful, the lower the risk for depression, anxiety, abuse, and suicide. Essentially, what this comes down to is the why question. Why are you at work? If you have a purpose behind what you're doing and you understand that and it's meaningful, then it can definitely help you cope with much more stressful situations. That's what I found in my experience. So the article goes on to say when employers encourage workers to spend time focused on their mental states with things like check ins or mental health language, they cause employees to ruminate on their problems and it makes them worse. And then the leaders can lend a sympathetic ear, but they're not trained psychologists or psychiatrists. And they lack the expertise to identify and address mental illness. So I'm not sure about the first part of that paragraph where talking about mental health causes people to ruminate on their problems too much. Let me know in the comments if you agree or disagree. But I do agree with the second part. What I've seen is that most leaders are not really capable of handling those kind of situations. They lack the expertise, essentially. And then the article goes on to talk about professional risk. And this essentially talks about what I discussed earlier, that if you do talk about your personal health information, like it or not, it can result in discrimination due to like this changed perception of your competence. Keep in mind, that's not only your competence today, but also your career advancement in future. And not only that, when managers share too much about their psychological struggles, it undermines how employees see them. So it looks like that cuts both ways. So the office just isn't equipped to treat mental health issues. So the article continues to say what does have a tangible effect is if they find their work meaningful. If you have meaning, it lowers the risk of depression, anxiety, substance abuse, and suicide. I'm curious, have you found this to be the case? So workers are more likely to report high levels of job satisfaction and low intentions of quitting if they view their work as meaningful. Now, I agree with the statement. I think if workers are connected to the purpose of what they're doing, it can help them push through tough times a lot easier, help them take on more stress because they think what they're doing is all worth it at the end. Conversely, if they don't, the exact opposite happens. They get depressed, they get demoralized. Essentially, companies would much rather have missionaries on their team than mercenaries. Mercenaries are there just for the paycheck, essentially, but missionaries believe in the purpose of the company. And frankly, this is really up to the leaders of the company to convey the purpose, to connect the purpose with what the workers are doing so they feel and understand that sense of purpose and what they're actually trying to achieve in the world. So while the article says that managers are not equipped to deal with mental health, one way leaders and managers can address it is by making sure employees are connected to the purpose. Research has found that people are more likely to derive meaning from their work when they focus on how it serves the greater good rather than how it advances their career. Hey, and if it can do both, even better, right? Other research has found that workers feel the most meaningful when workers have a strong sense of autonomy at work and believe their efforts significantly and positively influence the lives of others. So it wraps up by saying something I don't think is earth shattering, but that prioritizing positive health in the workplace is crucial. Most of us spend the majority of our time at the job. But it goes on to say that the solution isn't just as straightforward as awareness and open conversations. Really, the employer should ensure their staff have access to mental health care while building a positive culture that promotes meaningful work. Okay, so what's the bottom line here? I think it's true that there's a big increase in the amount of mental health issues, and it seems to be especially true with the younger generations. And I think there are a number of contributing factors to that. What I found that works for me is to be careful how I spend my time on social media. I think that's one. Prioritizing self care, as I mentioned, sleep, exercise, some downtime. And then I think it's also true that connecting with your purpose, and that can be both inside work or even outside work, can be super helpful to addressing some of these challenges. So, for example, even if you're not thrilled about the job that you have, if you can connect that to the purpose you have outside of your work, such as supporting your family or perhaps saving for something that you find meaningful that you'll do down the road, that can also help build resilience. At least that's what I found that works for me. But what do you think? Is mental health a big issue? Should employers be doing more or less? Comment below. If you found value in this video, please help by hitting the like and subscribe button. And if you're looking for tips from someone who's been in the trenches, feel free to sign up for my newsletter as well. Until next time, stay savvy.